Warm welcome to all of you. Happy World Standards Day. October 14th is the World Standards Day, which is celebrated across the globe. And the focus of WSD 2023 is actually on sustainability. It is a shared vision for a better global connect. The focus, the global theme this year is actually on SDG 3, which is Sustainable Development Goal for good health and well-being. So we have created a conversation today in alignment with the global theme to communicate and to connect with the marketplace that good health and well-being requires lot of assurances to the community, to a common man in the name of healthcare delivery. So whether we are talking about healthcare services or we are talking about healthcare products like pharmaceutical products or medical technologies, the assurance is very critical, and so the quality and safety of the products is also equally critical. So Consultants Consortium of Chennai and Management System Consultants Consortium are the two associations for management system consultants, where we constantly create marketplace conversations as knowledge dissemination series for industry and various stakeholders across various sectors. And so we do organize key milestone events, sessions on key occasions like this, and our interest is a knowledge dissemination. And as a consultants organization, we also consider this as our social responsibility to focus on constant knowledge dissemination, not only to the industry, but even to the communities. We also focus on consumer education. We contribute to a lot of nation building exercises in a small way that we can contribute. So today, I must thank the speakers who are joining us for the session. We do have Dr. Bhupendra Kumar Rana. Dr. Rana, who is the CEO of Quality and Accreditation Institute, who will be touching upon the healthcare services standards, the new global standard, which is released globally. And as part of the technical committee members, he has also contributed to the standards development. So this is an exclusive standard for healthcare services, that is hospitals and various other healthcare service providers, to bring that healthcare quality management system focus to the marketplace. And we also have Mr. Srinivas Dugirala, who's from BSI, who's joining us today. And so he will be touching upon the various assurance programs that BSI is offering in the healthcare space, be it for services or be it for products, because it's a global organization. They cater to the global markets. And post-COVID, especially after this COVID, there is a lot of need that was felt in the global markets that healthcare should come out with all the standards development organizations should come out with sector-specific standards for healthcare. In fact, it took ISO so long to develop a quality management system for healthcare of the sector-specific standard. Similarly, in the product space also, many standards are being developed. Healthcare is a common need of the community and a common man, and more such assurance programs are needed because the demand from the user segment is always very high on service standards and service quality when it comes to healthcare. So it is not just one standard or one program. It is not that services alone can offer an assurance with its assurance standards. When a hospital or a healthcare services provider says that his delivery is assured, it has to ensure that its supply chain and value chain is also assured, which means the pharmaceutical products or the medical technologies that are being used in a healthcare setting on the patients, by the users. So these, even the supply chain, value chain also should offer the same compliance to assurance to various global standards. And so Mr. Srinivas will be presenting about various schemes and the programs that BSI runs globally. And we do have industry representative and medical technology entrepreneur. We have a women entrepreneur, Mrs. Walli, who's the executive director of Panacea Technologies and who's one of the joint coordinators of IMET. And they are into cancer care technologies and developing cancer care products for many years. It's a very interesting combination, convergence in the conversation that we have created, because we wanted to bring that focus to the healthcare sector, that what are all the programs, what are all the assurance schemes that are available globally to offer that assurance. When we say healthcare delivery is assured, both the services and the products have to be in alignment. So with this opening note, we would like to initiate the conversation. So let me just introduce the first speaker. Just give me 1 second, please. Yeah, is the screen visible? Clear?
Yeah. Yes, please.
Yes.
Yeah. So the very first speaker today, the first session is actually about healthcare services, the new assurance standard, which is on healthcare quality management systems, which is ISO 7101, which is launched very recently. So this healthcare services quality assurance program session will be handled by Dr. B.K. Rana. Just a quick and short introduction about his profile. So he is actually, Dr. Rana is the CEO of Quality and Accreditation Institute, QAI, which is an accreditation body which is globally recognized, which also operates in the global markets, offering various assurance programs and schemes for the healthcare services sector. And Dr. Rana is a PhD in biochemistry, and then he's also a board member of ISQA, which is another international organization which keeps developing a lot of standards for healthcare services, and also various assurance programs also. And so Dr. Rana is a member of ISQA as well as ASQA, which is an Asian Society for Quality in Healthcare. And so he served as a chairman of ASQA, and he's also the founding member of International Academy of Quality and Safety. And he's also an international consultant and expert with WHO, World Bank, ADB, USAID, ISQA, UNFCCC, and various other international organizations. So he's also, being a scientific person, he is a founding member of the Scientific Advisory Board of International Alliance of Patients Organizations, London, UK. Now, he's got a very strong connect and depth and expertise in establishing a healthcare accreditation body, and then laboratory accreditation body, and then implementing quality management systems, accreditation requirements, standards development in the field of quality improvement and patient safety. He's quite passionate about doing different things differently, which keeps him motivated. So over to you, Dr. Rana. We're just looking forward to your session.
Thank you so much, Rama, and thank you very much for a very elaborate introduction. Really appreciate your time. Thank you very much for invitation. And I think this is my second of the day, no, third, in fact. There was another one, and maybe I think there is more after that, and fifth or sixth in last 3 days. So this shows the momentum in the industry and organizations who are actually driving the movement of quality improvement through standards. And as Mr. Johari was telling in earlier session when you were there, usually it is to be done by national standard bodies like BIS in India. They were doing it earlier and they were doing as, but now there is a momentum that this World Standards Day is being celebrated by not only the national standard bodies, but many other organizations who are making use of standards or developing standards. So really, thank you very much for that. And I would be quick in taking up the task which is given to me. Just a moment. Okay. Let me share. Okay. In this webinar by CCC, I'm going to talk about healthcare service quality and global new ISO 7101. ISO 7101 is a new standard published by ISO just a month, even not a month. It's in 2023 itself, which is a work culmination of last 3 years of several experts working on this standard to publish. This standard is published by ISO TC 304 Working Group 5. And I have been fortunate to be a member of this working group to draft this set of standard. And we have several meetings online, of course, because of pandemic and later on as well, by the experts from around the world. So once again, congratulations to everyone on this occasion of World Standards Day celebrations, which keep continuing. As Rama mentioned, the global theme this year is shared vision for a better world and standards for sustainable development goals. How a standard supports various sustainable development goals, including SDG 3, which is about healthcare and well-being of communities, which is very focused on healthcare. But it's not just healthcare with standard support. Standard also support several other SDGs, including elimination of poverty, and providing good quality of goods and services. And there are several other SDGs which I may not recall at the moment, but standards in many ways supports many of these SDGs. As we talk about healthcare, SDG 3 is actually the most relevant sustainable development goals of United Nations, which standards can tackle. Briefly about Quality and Accreditation Institute, we are operating as an accreditation body since August 2017. We have 14 standards already developed for various types of healthcare organizations, and 2 are in the process of development at the moment. We provide different services. Education and training is one of the core activity, which is related to several accreditation programs which we offer, as well as there are many generic and training programs we develop and deliver. We also deliver tailor-made programs for the specific organization based on their request. We provide accreditation to healthcare under the board of Center for Accreditation of Health and Social Care. We provide accreditation to laboratories under Center for Laboratory Accreditation, and we have developed a Center for Accreditation of Veterinary Facilities, as we have developed standards for veterinary hospitals and clinics. Under our healthcare program, we offer almost complete care continuum for a patient, starting from a clinic to an ambulatory care, to a hospital, to home care, to transition or rehabilitation or out of hospital care, telehealth, hotels and homestays, dialysis centers, IVF centers, emergency department of a hospital, healthcare facilities for green environmental sustainability standards and patient safety standard based on WHO standards, and stroke center accreditation program. So there are 15 standards in all which we have developed so far, 14 plus 1 basically, including hotels, which we provide to our clients. So it's almost full care continuum, starting from a smaller unit of healthcare delivery, which is a clinic, single doctor clinic, to a tertiary care hospitals, and then out of hospital transition care, or anywhere through telehealth and your home as well. We are internationally recognized by International Society for Quality in Healthcare, ISQA, External Evaluation Association, which is an apex organization recognized accrediting actually the accreditation bodies. So we are one of those accredited organization, and in India we are the only one who got this recognition in less than 5 years of operations. Our accreditation programs are recognized by Central Government Health Services Scheme, CGHS, and the Ministry of Health and Family Welfare, for hospitals, eye centers, dental center, imaging center, as equivalent to NABH accreditation. So any hospital or other healthcare facility getting accreditation from QI will get the same financial incentives from CGHS as they would get from NABH accreditation. Under our laboratory board is completely independent board, having a chair and a couple of members. We provide program based on ISO 15189 for medical laboratories. We have a program for certification, basically based on Clinical Establishment Act requirement. Plus, we have added certain quality management system requirements like internal auditing, management review, and also participation in proficiency testing component to the requirements of Clinical Establishment Act. So any laboratory who may wish to start their quality journey with the basic minimum standards can start from them and then move up to the ladder to ISO 15189 accreditation. We provide accreditation to testing and calibration laboratory as per 17025 and biobanking activities for biobank and biorepository as per 20387. It's a new standard published by ISO in 2018. And QA is the only body at the moment, Indian accreditation body in India, providing this accreditation. In that board, for this board also, we also recognized by APAC as a full member and a signatory in medical and testing as per 17025 and 15189. And also International Laboratory Accreditation Corporation, ILAC, which gives us international equivalence of acceptance. Coming to the standard, which ISO 7101 just published, and I think I am lucky enough to be, I think I have not heard since it was published that anybody has done any awareness program on this standard. So I'm lucky enough to start it on 11th of this month as the first program on this standard outlining, and this is my 4th session. As I already told you that what is this standard all about. This is the first global standard published by ISO on healthcare quality management system. So that's the beauty of this. The whole aim is to improve quality of care and patient safety. So the title of this standard is Healthcare Organization Management, because that's the ISO way of writing it. So it's a healthcare organization management, and within that, management systems for quality in healthcare organizations. So, and the requirements. The requirement means this standard is certifiable if anybody is interested to go for that. This standard provides requirements for management system for quality in healthcare organization. And this is applicable to healthcare system. So it's not just restricted to a single organization, but any healthcare system like a state public health system or state government health systems. And like in many countries, there are health systems developed, including India. I think if you take the whole state as a healthcare system, can also apply this in single organizations, which are not just limited to hospital. It can be any type of healthcare facility, as I mentioned, maybe clinic or a hospital or a blood bank or a dialysis center can also apply these set of standards with the aim to improve quality of its healthcare delivery and outcomes. So that's the aim of these standards. So this standard is basically outlined in several clauses. As you may be aware of the ISO way of writing a standard, there are clauses and sub-clauses within the standards. So clause 1 is about introduction, second is about the scope of a standard, and third is about the terminology, various terminology glossary used within the standard to define them for the better understanding and clarity. So clause 4 and onward, for 4 to 10, these are the requirements. Requirements mean they have to be met by organization if they need to get certified under these standards. So the first clause, which is clause 4, is context of the organization. Context of the organization means what type of organization is trying to implement these standards. Do they understand the needs of the stakeholders? Have they identified their stakeholders? What are the activities they are undertaking? So all those things has to be defined by the organization. And these are just some keywords in all these major clauses. I had just picked up the major highlights of the standard. But if you read the entire standard, you will find it very elaborative for each point of what I'm just mentioning. Even all points are not even captured here. So there is quite elaborated standard if you get a chance to go through it. The second clause, the clause number 5, is about leadership. Most of the quality management system guy understand that top management. In this, we have used the word leadership. Leadership means the people who drive the organization, the top management, basically the leaders of the organization who who are responsible and accountable for running the organization. So they have to demonstrate their commitment to the compliance of this requirement of the standards. And they have to define their quality policy. They have to define the roles and responsibilities at different level in the organization, including their own responsibilities and roles as a leader. Uh, Focus on service users. So the standard has a lot of focus on the service users, which means that patient, the next clause 6 is about planning. Planning means how the services are planned, and if there is a need to change any service or activity, what is the planning put in place so there is at least a disturbance in the services being offered? What are the risks and opportunities? So organization has to identify various types of risk to their organization, and these risks include financial risk, business risk, clinical risk, any type of risk which can create a problem for the organization, and how they take care of that identified risk and opportunities. Obviously, if there are risks, there will be opportunities also. So how the organization can make use of opportunities available and build on them to further improve. They have to define quality objectives, and these quality objectives must be in sync with the quality policy. So quality policy is an overarching statement from the leaders, from the top management, but how it is adhered to, how it is met with, is basically through quality objectives. So you have to define your quality objectives A, B, C, D, E, and then you have to develop models around them to meet. uh, Clause 7 is about support, and support is about resources, what resources you need. And resources may be all, human resources or facility resources or equipment resources, whatever resources you need to organize the system within the organization. Competence, competence of the people who are working in the organization. What are the qualification, skill level, competence levels are defined for the organization. Then communication. Communication means that how the communications are flowing within and outside the organization. Communication is very, very important, because of miscommunication or wrong communication, many times the patients suffer. Many patients don't get the correct information because the communication was not proper. So the organization has to define communication channels, communication methods, how they have developed and how they are being used for internal and outside external communication. And similar for information. Healthcare organization has to define what do you mean by information, what is the information mean for them in their context, and also to develop policies and procedures around how information is collected, how information is stored, how information is disseminated, how information is disposed of, and so on and so forth. Everything related to information. So they may need to have a simple information management system, which may be manual, maybe completely electronic, or maybe a hybrid of it. So it's entirely left to the organization to decide, but it's all about information management system, an entire organization, internal as well as external. Clause 8, operations, and this is the largest clause of ISO 7101 because it's about operational activities of the organization. It takes care of almost every operational part of the organization, starting from the planning of the services, that what clinical services you plan to provide and how you start planning and then put the services in place. Then facility management, and facility management is about the building infrastructure, about their safety, about their legal requirements, so statutory requirements. And then equipment, what equipment that type of organizations require, and whether they have a system of maintenance, regular maintenance, annual maintenance of equipment. Do they have a system of calibration? Are they getting equipment calibrated? Because calibration is essential for the correct performance of any equipment. So it's all about that, how the inventory of equipment is managed. Waste management, and waste management include both general waste and the biomedical waste. And for biomedical waste, the organization has to be more careful because there are laws around it, there are regulations around handling and taking care of the biomedical waste. So that you have to have policies and procedures for almost everything. Policy and procedure or processes are required. Then handling of materials. So all type of materials, whether it's a clinical, non-clinical, any supply, you are having how you handle them. Supplies and services. If you are getting supplies from outside, how you decide the vendor, what qualification criteria you set, how you identified them, and then how you get the solution and how you monitor their performance over a period of time. And same thing for the services. Common examples are housekeeping services, security services. Usually the organization outsource. So if they are getting those services from outside, what is the provision they have made? And then service provision. Service provision means what are the services they are offering. People-centered care. This standard is very much focused on patient, person-centric care, which means person-centric care or people-centric care. It's the same thing. People-centered or person-centered. What does it mean? It means it's not just patient in the center of the care, and then family around, the community around as well, which means it's not just when you are having treating a patient, you're not just taking a single person. Is a person which is actually is having the family, because many times if you just stick to the patient may not understand your language. Patient is not in a situation to even to listen to you. He's not conscious. Then who will make the decision about the patient? The family members. Patient if can't take the medicine themselves, many in the situation, who will give the medicine? The family. So if family member don't know what is to be done, then how the care will be delivered appropriately, how the patient safety will be ensured. So it is important that we have to move toward person-centric or people-centric care now. Ethics. What are the ethics? You define an ethical practices. Organizations must function in ethical way. So whatever practices you are implementing, they need to be following ethical principles. Patient safety is one of the core area in this standard. Patient safety include medication safety, injection safety, blood related safeties, infection prevention and control, falls, whatever are contributing factors for patient safety are covered in that. Workforce well-being. So this is about staff, the people working in the organization, doctor, nurse, paramedics, and engineers or housekeeping, anyone who is working, how the organization ensure their well-being. It is very important. And we learned a lot of lessons from COVID-19 pandemic. When people were suffering, the staff was facing problems. They were also getting infection, and they were not able to deliver care to the patient appropriately because they themselves are suffering. They have fear in mind. So it is important that we need to create a confidence in the people working in the organization that they are safe. Organization has to provide all the appropriate facilities to staff to prevent them from any harm. So that's very, very important. Clause 9 about performance evaluation. This is important again. Unless you measure, you don't know where you are heading to. So you need to monitor your performance. You need to measure first. Before monitoring is done when you have something in hand. So that is done through measurement. And when you collect the data on different indicators, and then you measure them, start measuring them. And once you get the data, you analyze that data. And based on that analysis, you make the evaluation. And that evaluation can act as a monitoring tool for you. And as I mentioned, what you measure is about indicators. So you define your quality indicators, both clinical and non-clinical indicator, managerial indicators, process indicators, structures indicator, or whatever you feel like. And we have given some examples within the standard. And then internal audit, and almost all the quality guys understand the importance and purpose of internal audit. So this standard is not exception to the requirement of having internal audit process in place, and also the management review. So how the management knows about the performance of the organization through the management review process. Last but not the least, clause 10, which is about improvement. Now, whatever you do, you have to demonstrate the improvement. So there is a continual improvement requirement. And then again, it is done through indicators. You define your improvement indicators and then measure them. And you can link with the clause 9 as well. So you draw some of those things and put it here. Then if there are any non-conformity identified, non-conformity means non-compliance to the requirements in the standard. So if you identify any non-conformity, what you do with that? You can't just sit on them. You have to take the necessary corrective actions, put the action plan in place, start monitoring the performance of those corrective measures which you have taken to see whether they are really effective when they are implemented to take care of that specific non-conformity. And those processes will lead to improvement. And therefore, you need to define your performance indicators to demonstrate continual improvement in your system. So this is about the whole 7101 framework. I just mentioned the major clauses 4, 5, 6, 7, 8, 9, 10, and then a couple of key points from the standard to give you an overview of 7101, the first world standard on healthcare quality management system. Now, way forward for Quality and Accreditation Institute, how we see this is standard, how we can make use of this standard. So we have options, and we have a separate board. One is an ISO board where we can be an accreditation body to create certification bodies. Certification body can certify healthcare organization using these standards. And for the information, and there is another document 17,021 -15 is being developed by ISO Casco, which will be acting as a guidance document. In fact, defining the qualification and the requirements for the auditors as any quality management system. The standard is supported by 17,021 dash 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 series of documents. Now this is for 17,021-15 as a document for supporting this standard implementation audit process is being developed. It is about to be published by ISO Casco. So we can use that method. And another method for option for us is to use the standard with additional requirements, if so, under our healthcare board to provide accreditation or certification, whatever term because in healthcare accreditation and certification are being used interchangeably, but not in ISO system. ISO system very clearly defined what accreditation means, what certification means. Accreditation is basically how I define is accreditation in ISO term is accreditation is certification plus technical competence. So if you are 9001 certified and if you demonstrate technical competence to perform a job, you can be accredited. And that's how we see it as the technical competence criteria. So we can use this standard to develop a new product under QI Health Board. We can define certain specific organization type specific criteria to supplement 7101 in terms of either resources or competence or management, facility management or equipment or many other things. I just pick up a couple of important points where we can develop, because this is a generic document for any type of healthcare organization. We can develop specific criteria which can be used in conjunction with 7101 to certify a specific type of dialysis, blood bank, imaging center, so forth, so on and so forth. So we can make use of that. And we are really seriously working on this to how we can really move forward. Certainly, if we choose to go this way, we will definitely start conducting program called DIVE, which is documentation, implementation, verification, and elevation. This will be a tailor-made program crafted around 7101. Talk about its documentation requirements, how you can implement it, and then how you can verify through internal audit. So we'll talk about internal audit processes, tools and techniques, etc., which can help you in improvement, elevation. And obviously the awareness programs need to be conducted around 7101 to create more awareness on this standard as we just started off. So I think India is leading. I would say India is leading in disseminating information about 7101. I have not heard yet from any other AV which has started any awareness program on this or any such activity. So I think India can be a leader again in getting things done as per 7101. Thank you very much for giving me this opportunity, Rama ma'am and CCC, and share my thoughts on 7101. Thank you very much.
Thank you. Thank you so much, Dr. Rana, for that insightful presentation. It was pretty detailed and it is also needed. Maybe we're looking forward to have having a couple of 1 or 2 days training workshop subsequently, because that detailed training is also required for industry consultants, stakeholders, everybody. Thank you so much for the detailed presentation. So we will move on to our next presentation. Next session is on healthcare products and healthcare services, the various initiatives, the programs or the schemes that BSI has to offer to the healthcare sector, be it for services or products. So the next session is actually from, just a second, Mr. Srinivas.
Yes, yes, Ramana.
Just a second, as a screen. Yeah. So we have Mr. Srinivas Dugirala. He is from BSI Group, which is a global organization and assurance organization. BSI is one of the oldest assurance organizations from UK. So Mr. Srinivas is a lead auditor with almost about a decade experience in auditing quality, energy, environment, OHS, and asset management systems. And prior to his stint in BSI, he was working in oil and gas sector for almost about close to about 2 decades in IOC and Kuwait National Petroleum Company. And his work experience included commissioning and operating the India's first RFCCU unit, and he's well versed in auditing EMS, that is environmental management systems of pharmaceutical sector and various other process industries. We request Mr. Srinivas to take over and present to the audience about the various programs that BSI that can offer to the healthcare sector. Over to you, Mr. Srinivas. Thank you so much.
Thank you, Ramana. Just sharing my screen. I think my screen is visible, right, Ramana?
Yes, please.
Yes, sir.
Can I request the audience to mute themselves, please?
Okay, thank you. Thank you, Roman, for the introduction. And today I will be talking about AMR Industry Alliance Antibiotic Manufacturing Standard, which is gaining prominence in India, and why it matters to all of us. So thank you once again for the invite on this auspicious day and World Standards Day. Thank you for the invite. And a little bit about BSI. We already explained about the British Standards Institution. And we are a purpose-driven business focused on organizational resilience. And the organization works for the public good and to improve, standardize, and simplify business management systems. It's not distributed, and we are independent from outside influence. So BSI inspires trust for a resilient world, and we are into knowledge, knowledge solutions. We are into development of management system standards, purpose services, assurance services, into system certification and product certification, in addition to the training services which we give. We are also into product certification of medical devices and consulting services. Are not in BSI India. BSI US is into consulting services as well. So that's about British Standards Institution. And BSI spans the world, and BSI clients represent 50% of Fortune 500 companies, 84% of FTSE 100, and we have 84,000 clients in 193 countries. And new standards, 3,100 new standards per year, 63,000 in all. And we have trained around 212,000 delegates trained the last 1 year, and 232,000 audit days delivered in the last 12 months. And so that's about BSI, so services across the world. And today I'll be talking about AMR. AMR, antimicrobial resistance. What exactly is antimicrobial resistance? It is the ability of a microorganism to prevent an antimicrobial from working against it. What exactly is an antimicrobial? You're all aware about antibiotics, antivirals, antifungals, and antiparasitics, which are medicines used to prevent and treat infections in humans, animals, and plants. So antimicrobial resistance occurs when pathogens change and they find ways to resist the effects of the antibiotics which we are using on humans. They survive and they try to spread their resistance to those antibiotics or antifungals or antiparasitics. This process of adoption leads to AMR, antimicrobial resistance. It is becoming a global threat. And we are all aware about the resistance of these microorganisms. So having it, and it occurs naturally, and it has been occurring earlier also. But the rate and the spread is accelerating a lot during these days. And World Health Organization has also described AMR as one of the biggest threats to global public health today. That's the reason why people are working on this particular AMR issue coming from healthcare or pharmaceutical industries. Everyone is talking about AMR, antimicrobial resistance, and how to address this. Causes of AMR, what is that? We are talking about antibiotic resistance, which I was explaining now. So what's the reasons for this microorganisms developing resistance to antibiotics? This is because of overprescribing of antibiotics, and we are not using the prescribed antibiotics as per the medical practitioners. And that's what it was mentioned, like by patients not taking antibiotics as per the prescription. Unnecessary antibiotics are used in agriculture for growth promotion, and the livestock we have been using in aquaculture. We use a lot of antibiotics for promoting the growth and all. And poor infection control in hospitals and clinics is also contributing to AMR. Poor hygiene and sanitation practices and lack of rapid laboratory tests to address these kind of issues. These are all the causes of antimicrobial resistance. And also there are some reports which are talking about the manufacturing emissions. So we are talking about antibiotic prescription, patients not taking antibiotics, poor infection in hospitals. What about the manufacturing industries? So these emissions from manufacturing industries, like contribution from the wastewater and other emissions from the API industries. API, what I mean is active pharmaceutical ingredients. So there are reports which are talking about these pollution from these pharmaceutical industries is causing a pollution crisis. They are entering into the water bodies. There are a lot of reports talking about this subject. So one of the companies, Nordia Asset Management Company, talked about pharmaceutical pollution in India as a bitter pill. So there was some report on these subjects. So talking about these emissions from the process industries or pharmaceutical industries. So what is the impact of this AMR? The impact on human health is enormous. The reason is, you're all aware, there is a risk of developing resistance to life-saving antibiotic medicine. We are using life-saving antibiotic medicines, but there was no impact on the health outcomes of the patients. So you also see the economic impact is also extreme. You're continuously using a lot of antibiotics. This antibiotic is not working, you try to prescribe another antibiotic. So the reason is, there is the microorganisms are developing resistance. So if you see the WHO statistics, they say 7 lakh people die each year because of drug resistance infections, and 480,000 of people develop multi-drug resistance tuberculosis each year. Due to resistance to antibiotics, as I was explaining now, treatment for common infections are proving ineffective. A common infection could not be treated with antibiotics. We are continuously using other antibiotics to address WHO statistics. And as I mentioned, the common infections are proving ineffective in more than half of patients in many parts of the world. So if you want to see really what exactly is this AMR issue and what the impact of AMR on public health, you can look at WHO site. It talks about the antimicrobials and what care we need to take. A lot of information is available on WHO. And what is the role of each individual, each stakeholder to address this issue was clearly mentioned, and there are some awareness campaigns. Campaign material is also available. A lot of details are available in WHO organization. So how do medicines get into this issue enter into environment? So there are a few ways in which these medicines like antibiotics get into the environment. Generally, it is mostly through normal patient use, that is human and animal use. So medicines are taken and these medicines get metabolized, and some could not, and they are excreted. So there is some treatment that happens in processing of wastewater, there's some reduction. But however, this wastewater goes to the environment. And also, as I mentioned earlier, the major portion comes from agriculture through the application of manure as a fertilizer to land and use of antimicrobials in aquaculture. Some is from disposal of unused medicines. And a small amount is also lost when medicines are manufactured sites. Like, as I mentioned, active pharmaceutical ingredients, the companies which are into API manufacturing. So a small amount of antibiotics lost when these medicines are manufactured at those sites. So even though these manufacturing emissions are not the main source of these antibiotics in the environments, but some companies are taking a risk-based approach to address this issue. So environmental implications, they want to minimize the environmental impact of these emissions, and they are taking proactive measures. So especially pharmaceutical industries. Why focus on India? What is the reason? The standard which I was talking about, it's mainly pertains to API industries, the industries which are into API manufacturing. So why there is a focus in India? You are all aware that India is a major supplier of antibiotics globally and locally also. As I mentioned earlier, there were reports talking about the environmental controls implemented in these sites, and there were some concerns raised talking about the impacts of pharmaceutical pollution on the communities and the environment and the water bodies around those sites. So that there's a focus in India because of these concerns, and there are standards being formulated to address these issues. And some companies already started implementing the AMR antibiotic standard requirements and going for certifications as well as a pilot projects. So what is the pharmaceutical industry's response? So there is a largest private sector coalitions established, which is termed, which is called as AMR Industry Alliance. To this AMR crisis, around 100 biotechnological, generics, and research-based pharmaceutical companies and associations joined together and formed a coalition and trying to address AMR crisis. So in June 2022, the Industry Alliance Group published a private standard to describe how to responsibly manufacture antibiotics. This standard is called Antibiotic Manufacturing Standard. The intention is to minimize the risk of developing antibiotic resistance and aquatic ecotoxicity in the environment resulting from the manufacturing of human antibiotics. The standard has been developed and it has a framework and the requirements as well. I'll explain few details of those requirements coming from that standard. So the standard structure contains introduction, the scope of the document, and normative references, terms, definitions, and abbreviations, and wastewater management programs, a company that should have that implements this standard, and solids management program and management of change. These are all the various aspects touched upon by AMR standard. Few definitions included in the standard are active pharma. What exactly is active pharmaceutical ingredient, biologically active ingredient in a pharmaceutical drug? And the definition for antimicrobial resistance, acquired ability of a strain of bacteria, viruses, fungi, or parasite to better withstand treatment with antimicrobials than the corresponding wild-type organisms. What exactly is antibiotic waste? Waste that is suspected to be contaminated with antibiotic API, regardless of concentrations. These terms and definitions are included in the standard, and few other definitions included. Predicted environmental concentration, the calculated concentration of a chemical in the environment, typically using modeling or conducting a mass balance around the API content in the wastewaters. Predicted no effect concentration, the concentration of a chemical below which adverse effects in the environment are not expected to occur. So the levels always should be lower than the predicted no effect concentrations. So that's the target for the pharma industries. And a risk coefficient is defined as a performance indicator. It is a measure of risk that compares the predicted environmental concentration to the predicted no effect concentration. So as RQ and PEC divided by PNEC, it should be less than 1. If it is higher than 1, the company has to do a risk assessment and come up with mitigation measures. So AMR standard also covers the management of antibiotic process wastewaters discharge during manufacturing to meet predicted no effect concentration, and the methods to minimize the amount and concentration of antibiotics, and handling, treatment, and disposal of other antibiotic waste to minimize or eliminate release of antibiotics into the environment. So a few aspects, few important points I just want to touch upon. The standard talks about wastewater management program. What kind of program a company should have within its site? So there are some guidelines given. There's some requirements specified. So like antibiotic concentration in manufacturing wastewater discharge shall not increase the risk of antibiotic resistance developing in bacteria and the environment. How will you come to know that the antibiotic concentration is less? So that, as I mentioned earlier, I talked about risk quotient. It should be less than 1. That is PEC by PENEC should be less than 1. That indicates that the concentration is on a lower levels. And also the company has to demonstrate that the permit compliance. If you talk about India, it's consent to operate, and the environmental conditions stipulated in the permit. So the company has to demonstrate the compliance. And also, it's not only the compliance, also it's talking about the effectiveness of the management system, the effectiveness of the processes managing this compliance part. So ultimately, what we want is processes need to be built around the system, not around. Another one is like wastewater monitoring devices need to be in good operating condition, and reportable deviations, if there are any, they have to be investigated, and they have to implement corrective actions, and also look at the effectiveness of those actions taken. So these are all few requirements under wastewater management program. Other requirements include characterizing wastewater discharges. We need to characterize wastewater discharges. We need to quantify and also assess antibiotic discharge. How could you achieve this? How will you fulfill this requirement? You need to do a water balance. You need to have process flow diagrams, and we need to have a criteria defined. So these are all a little bit new compared to ISO 14000 and 2015. Here you're talking about details. So doing a water balance, antibiotic content balance, what's the balance, like how it is flowing through, and we need to have process flow diagrams. So it should be very clear, and criteria also should be defined properly. And also, you need to quantify antibiotic residue in wastewater and assess against environmental protection criteria to measure risk. And also some good management practices have been given in this standard, like minimizing the API discharges. The companies have to take actions to minimize API discharges to reduce the load on the wastewater treatment plant, and also see that the concentration level of API content is on a lower side. Closer transfers of the materials. That's also now most of the companies are into this subject, like they're avoiding open transfers to avoid spillages and all that, emissions. So that's one of the good practices indicated in the standard. Also, spilled material needs to be collected before washing. Anything gets spilled immediately, it's not necessary, it's not required to wash it immediately, because again, it will increase the load on the wastewater treatment plant and generation of wastewater. So practice is to collect the spilled material before you wash it. And also process evaluation. We need to relook at the processes to increase yields. So again, reduction of waste, a reduction of antibiotic content going into your waste management system should come down. That's the expectation. So we need to reevaluate our processes to increase process yields. And also AMR standard also talks about solids management program, and solid waste containing antibiotic residue shall be managed on-site and off-site as well. So prevent and mitigate accidental spills and releases to the environment. We need to inspect spill containment integrity to prevent the discharge of waste materials into the environment. And solid waste are to be stored to prevent the discharge as a result of rainwater's runoff. Anyway, we have hazardous waste and management rules in our country, so we need to follow the guidelines as well. And so all these requirements are also stipulated by the regulatory bodies. Management of change is one of the important clauses. Whenever you have any changes in the processes or the equipment, infrastructure changes, that could impact the performance with respect to environment, like discharges. So there is a need to review and update risk evaluations when significant changes to operations are a structured approach that is expected when a particular process getting changed or activity getting added to a company. So there is need to be a management of change. It is similar to other management system standard, but it's a little bit emphasis is given on this particular clause as well. So computing PEC, as we were discussing earlier, what exactly is a PEC? PEC is the concentration of antibiotic in the receiving water resulting from a manufacturing discharge. So all this data, this needs to be determined. How will you determine this? We need to quantify API losses to wastewater, either through mass balance or analytic testing, or applying appropriate API treatability and dilution factors. So as like certification bodies look into mass balances conducted by the organizations and batch record reviews, yield data, these are all the required documentation for this particular parameter to be verified. So what are the benefits of this standard? So the organizations could demonstrate compliance to the requirements specified in the standard and address the AMR issues. Customers, most of the customers nowadays are asking about for the evidence that antibiotic products are made responsibly, and these products, once certified, would streamline and simplify the process for these customers. Today, with customers, if you say to your customer saying that we are into the subject of AMR, we are planning to address AMR issues by adopting this AMR standard, that gives a good trust in the marketplace. So as I mentioned, most of the customers and some of the companies are also into this subject, and voluntarily they are going for this kind of certification, adopting this system requirements. If all customers ask for this certification to drive all suppliers of medicines to manufacture responsibly to sell products, creating market incentive to do the right thing for the environment. So right now, this standard is applicable only to the companies making APIs, not intermediates. They can use it, but intermediates, the scope is limited to companies making APIs. So call for action. AMR is a significant and growing global health threat with dire consequences if left unabated. So AMR Industry Alliance Framework and PNECs offer good direction to all antibiotic manufacturers. They can use to manage risk, do the right thing, and ensure continuity of your business. Good that you are representing your company today. Engage, learn, and commit to take actions on addressing AMR issues in your business and resources. So AMR Industry Alliance has a website which has all the details, and you can download the standard as well. And WHO has a lot of resources about AMR, and you have awareness toolkits. In fact, I was happy to see a Trello board created by WHO, very innovative, and all the details about AMR are in a Trello board. It's very good, and people can download, and you have logos, you have campaign materials. So awareness for creating awareness sessions within the businesses. So, and also AMR also has given PNEC data to comply with PEC. You can compare with PNECs. AMR Industry Alliance. So these are all the resources. So that's about the AMR. Any questions if you have?
Thank you, Mr. Srinivas. We will take the Q&A towards the end of the session. Thank you so much for that insightful session on the Pharma Assurance Standard. Even we did attend the launch session by BSI. This is a very good scheme, and AMR is a global mantra now, and be it on the services or on the products, lots of initiatives that are being taken up in the country to address this biggest problem statement. It's good that some assurance standards are developed from the product side. Maybe more and more industry education sessions, even to the user industry, the healthcare, as I keep saying that, hospitals and other services providers, they also should know about the assurance that they are getting from products, which is critical. So I keep telling them generally, by and large, because the supply chain has got assurance standards much before the services. Services has come out with the assurance standard now specifically. So more such connected conversations are very critical, and to the convergence is what we are trying to create. That is something which we are always trying to do from our association to bring that. Excuse me, can I request? Yeah. So this is the convergence that we are trying to address. Thank you so much for that insightful session. So we'll just move on to the next session. Just give me 1 second, please. The next session is actually on the healthcare assurance, the standards from the products again. And we have with us Mrs. Valli. She's a women entrepreneur and a STEM entrepreneur from medical technology space. So Mrs. Valli is the executive director of Panakia Medical Technologies, and they are into developing cancer care products and cancer care technologies, and been in this domain for many years. And she's one of the most active joint coordinators for IMED. IMED is the largest association for Indian medical device industry, and which is the voice for the medtech manufacturers in the country. And she's one of the most active coordinators, keeps contributing on many initiatives. And she's an engineering graduate from NIT Warangal, and she's got close to about 3 decades of experience working across various sectors. And she's into medical equipments, product space for almost about 2 decades again, 16 years of connect with her. And she will be talking about the assurance standards that are available in the medical technologies domain and across the globe. So over to you, ma'am. We are just looking forward to your session.
Thank you, ma'am. Is my screen visible?
Yes, ma'am.
Yeah, sure.
Maybe full screen mode, please.
Yes, yes.
Yeah, it is visible. Thank you.
Yeah. Yeah. Once again, thank you, everyone. Thank you, ma'am, for this invite, and it's my pleasure. Today, I'm going to share about our experience, how we got benefited because of the various experts who have given the presentation and who across the world who have defined the standards, and how we have using that standards, how we have developed a product and how it's implemented, what are the benefits of it. I'm going to share about our experience. See, to brief about, we are these are the solutions in which we offer. We are into manufacturing of mammography machines, radiotherapy simulators, which are used for simulating a patient before putting the patient for the treatment. And in the therapy space, we have linear accelerators, which are very high-end machines, and we have cobalt teletherapy machines, and we have various radiation accessory tools and accessories. This is how it looks like, once the machine is installed. This is a very complex machine, and we are very proud to say that we are the only manufacturers in India, and globally there are only 4 players who are into this space, and in Asia we are in whole Asia we are the only manufacturers of the cancer therapy in the radiotherapy. And so far, around 4 lakhs plus patients have been treated. We have installations across India and all over the country. And to just a recap of what the SDG goals, which we all know. So today, being the focus as good health and well-being, and just I'm populating this to show that the other standards other goals are directly or indirectly required into this to get the good health and well-being, are contributing. Knowing about these standards, understanding about the parameters and the requirements that they are saying, it will be very helpful. As ma'am said, sharing the education, bringing the awareness, being in the quality education, gender equality, clean water and sanitation, being the affordable energy, because these standards, once we know, when you design a product, it will be very helpful how to optimize, how efficiently you can design a product. In fact, our products are working even in the South Africa and remote areas where the infrastructure is very difficult and power challenges. So even in that kind of environment, you can have these kind of products if you are well aware of these standards and the best practices which you can take from this standard. This slide talks about, the previous speakers spoke about the healthcare industry where the patient's care. Now, it is required, right, entire throughout the life cycle of the product, be the patient care or the medical equipment, and the end of the life disposal of it. When you decommission it. So in the medical device space, to contribute how it is contributing these SDG goals is like right from the entire medical device space of right from define, manufacturing, transportation, use and dispose or recycle of it. We should be aware of whatever the standards are there, those things which need to be considered while you are designing, right from the time of designing of the product, so that you can plan well and have the appropriate labels put in place, the best practices which we can take, and also the end of use disposal, and ensuring taking care of our environment, those things needs to be considered. Like for example, when it comes to the design space, here responsible consumption of the raw material. When you're designing itself, you need to take care of be compliance to the IEC 60601-1-9, where it talks about environmentally conscious design, and be the ECD of the applying various principles. While doing that, even because we need to take care of the risk management, even fortify the occupational health. So those parameters also need to be, and information security, then even the green gas house emission, because how during the operational space, how we are taking care of it, would be really helpful. Even in the product quality level, innovation and the responsible material consumption, and in the infrastructure space, the cyber security, how we ensure and how we design the product, it would be really helpful. So in the coming slide, I'm going to talk about how we need to take care of during the design, production, installation, treatment, delivery, and post-installation. So the standards being defined, we have categorized into product and process. Under the process standard, one of the advantage though for the SMEs, it is not applicable, but not mandatory, but it is really good practice we started implementing for the past 3 years of ESG compliance. So unlike with the quality management system, where it is a straightforward, wherein one particular standard, depending upon the class of the product and the category which you choose, you apply. Whereas when it comes to the ESG, there are various frameworks, and each frameworks it has its own beauty of the benefits which will share. So if you can as applicable to the product, we can take that one and then implement, integrate it into part of when we are designing the product itself, from the inception till the installation and post dispatch. It will be quite helpful, and it will be contributing towards the SDG goals. Here, if under the process, we take care of the applicable ISO standards, be the FDA or MDSAP, of course, which is integrated in the ESG standards, the national standards, and the product level, the applicable IEC standards in Europe and US and Russia, and depending upon the country where we market the product. Where prior to the integration of risk management into the management system, we were following like 14,000-14971. Now it's been integrated into all the standards. It's quite helpful. Similar way, whereas the other environmental standards, 1445 and 27 standards, are not being integrated, though are just being called, but it would be quite helpful if we go in detail and implement whoever starts in the design of the product. And this is talks about the product design at various stages. These standards are applicable, and the benefit being the right from the user needs to requirements, be the product development, be the prototype, pre-launch and production, defining the essential and health and safety requirements, information security and cyber security requirement, usability and human factor engineering, biocompatibility, packing and labeling and eco-design, the language requirements, post-market surveillance and clinical follow-up. The risk management is applicable across all over the stages. And this is one more depic of what these standards gave us, and how it'll be helpful when we implemented 13485. It helped in the applicable standards, be EMC, EMI, biocompatibility, etc. And when it comes to the ISMS, the information security, cyber security, network data, personal data protection, and DOHS and occupational health, eco-design and life cycle assessment, circular economy, greenhouse gas emissions, and waste management, which the previous speakers already touched base. So what is the outcome of it? Healthcare. By implementing these standards, we can give a quality, safety, security, and reliable and eco-friendly products to the nation. That's all. Thank you. If there are any questions, I'm happy to take.
Thank you. Thank you so much for that wonderful presentation, ma'am. The manner in which the SDGs were mapped to standards, it's amazing. Thank you for that. And I was really surprised first time to listen to a manufacturer who's doing ESG compliance on a voluntary basis, not just a manufacturer, even otherwise in the industry. That's really amazing and very interesting, very inspiring too. Thank you for that. And any questions from the audience before we take the questions? Let's do a quick poll on just to check how much you like the session today. It's just the feedback session. Aarti, can we have the poll, please? It will be there on the screen, and yeah, you can. This poll will run for the next 2 minutes. Request all of you to submit your responses, please. Can you see the poll on the screen? Please do it. Take the poll. So the 29 members here, we'd like to see the feedback from all. That's a small motivation for us to do more sessions. Requesting you all to take the poll, please. It will run for another 1 minute. We can close it, Aarti. Okay. Now, having come to the fag end of the session, over to you, Atulji. I'm Rama Venugopal from Consultants Consortium of Chennai. We have Mr. Atul Madhur, who's from Management System Consultants Consortium. We have 2 associations of Management System Consultants. It's our passion to keep creating, create this marketplace conversations. Over to you, Atulji.
Yeah, thank you. Hi, hello everyone, and thank you for a lot of information that has been definitely shared. The 1 hour session of time to learn, unlearn, and relearn, by God, it was definitely an enlightenment one. On behalf of MSSC and NCC, I would like to thank our heartfelt gratitude to all those who have made this webinar most possible. And first foremost, I would like to express a sincere thanks to our esteemed speaker, Dr. Bhupendra Kumar Rana from QI, who has shared a lot of insights on our healthcare organization management standard 7101, walking us through not only the major steps, but also what we need to look for and how the flow of information, which is relevant to the clause of operations. Sir, thank you, sir. Your session has been truly informative. And our second speaker from BIS, Mr. Srinivas Dugirala, who has shared us a detailed dive on the antimicrobial resistance, AMR, and how it's impacting and its consequences which you are facing. Sir, thank you very much for giving us a heads up on AMR, the impact of it and how it is being tackled with the emergence of the AMR standard. And a brief synopsis that you've covered on how the wastewater management program and with the solid management program, the risk involved. Sir, thank you, sir. In a very short time, you've covered a detailed lot. Finally, our woman speaker, from a medical entrepreneur, Ms. Wali, ma'am, this was a visual treat that you have given us on how you have integrated not only just your interaction with various standards across the medical product development to achieve the SDG goals. Thank you very much for all of us. We would like to extend our gratitude to all our attendees, without whom your participant enthusiasm, this webinar would not have been successful as it was. I also want to acknowledge our technical team and support staff who have actually been working behind the scenes to ensure the seamless and trouble-free webinar. Least and not the last, but we hope that you have gained valuable insights and knowledge from today's webinar. And we encourage all of you to continue exploring these subject matters and to stay engaged with our future events. This webinar would not have been possible with the collective efforts of everyone. So I thank everyone for your presence and contribution. Thank you, Bas, for joining us and looking forward to see future webinars, ma'am. We should have this future more and more detailed sessions now with every one of us.
Request
Thank you,
all
sir.
of
Very
them.
good session.
Request all of you just to turn on your video so that we can take a quick peek, please. Yeah. Sorry, Atulji, did I interrupt?
Yep.
You're saying
No.
something?
I'm just totally enamored.
Aarti, can you take the pic? Yeah, that's it. Thank you so much. Thank you.
Thank you very much. Thanks to you too also. Thanks, a great session. Thank you.
Thank you.
All the best. Take care.
Thank you.
Thank you.
Bye-bye. Bye. Have a
Bye.
nice day,
Thank
everyone. Bye-bye.